Sanford Research is built on that premise that we ask the right questions, because those questions are driven by a desire to help people.
I was 10 when I wanted to be a scientist. I asked a lot of questions about why something works a certain way.
If you think you know something, you don't know something, you take a different path, you figure it out.
We're asking questions and saying, here's a problem in front of us, how do we fix this?
That's what we do. Scientists, we ask questions. What makes us a good scientist is, are we asking the right questions? Research is important because everybody's lost a loved one, and everybody's said those words, I wish more could have been done.
I lost my best friend to a rare cancer when we were 30. And so it's something that I have learned to recognize within my own life, and my passion for working in this part of research.
Once you kind of understand what the patients are going through and their families, you do, I think, acquire a sense of we need to get better.
Always just do what you can to make a difference for your patient. Just like they're your own mom or your own, child. That's what drives me.
How do I take these treatments that are really promising in the lab and get those to patients right away? When we're looking for new research opportunities, new treatments, it's what are the things that are going to really change the game?
That's an inspiration. You just think about why you're doing it and who you're doing it for, and that'll get you the motivation to do that extra work.
The goal is to improve the health and well-being of every population of patients, to find new discoveries, new ideas, new innovations that will really make a difference. It's a process, and it's a huge effort, and it takes a team of diverse thinkers and innovative and creative people.
It is so amazing to see that light go off when they understand the process of the scientific discovery and how that can really have an impact on the patient population.
The scientists get informed by experienced clinicians who can teach us a lot. And the patients wind up getting the best cutting-edge treatments.
Everybody's work is able to benefit from that, so we're making a difference for a wider number of patients and a wider population of diseases. It's really creative and innovative. It's really exciting when you have those aha moments in the lab where I just discovered something that's going to shape the future of care.
Once you've discovered something, you move that work forward. Once you understand, then we have a possibility of intervening.
The work we're doing has directly influenced patient experience and outcomes.
We have patients with type 1 diabetes, we have patients with certain types of cancers, we have patients with rare diseases.
I think about the ability to focus on patients that desperately need help. At any time, there's 300 to 400 active trials going on within the Sanford Health system.
The national average is about 3% of patients go on to those trials. Right now, if you're a Sanford patient, 13% of our patients with cancer diagnosis for eligibility for clinical trials go on to a clinical trial.
In childhood cancer, for instance, some of our most common diseases have very high cure rates. Children are surviving for years and going on into adulthood cancer-free. So that's one area where we can say we've really made a difference.
We're seeing these amazing results, and I think that's really, probably the best part of my day is when we're able to share that news with the patient.
We have as good of outcomes, if not better outcomes, than many other large NICU centers across the nation. And I'm so proud to say that research made a difference in making that happen.
One of the most bold statements that Sanford Health said 13 years ago was it was going to cure type 1 diabetes. Pretty bold for an organization that didn't have a research arm at the time.
That is why Sanford Research is important. They fund those innovative ideas.
The most important thing that research does is it never accepts what is current as the best that it can be. Things can always be better.
So many things happen in this building that people don't know about. Not only the amazing science, but on the education and outreach side, we're really advancing that next generation of medical leaders.
We've seen some pretty dramatic changes in our treatment, but we can always improve. We can always do better.
You have to keep looking forward, looking for new answers.
You may not even see it in your lifetime, but in science you have to persevere and really know that what you're doing will make a difference.
Sanford is really becoming known nationally and even internationally in research circles because of the work that's been done and is being done currently. I'm very proud to be part of Sanford Research.
We want to impact patients because we're a part of a health system. We should never forget that. But more importantly, we should be able to educate the community the importance of what we do.
Research is essential because we will never have new therapies and new breakthroughs. We can keep doing the same thing that we're doing in medicine, but there's still patients that are not having their needs met and are not able to live out their full years of well life because there aren't breakthroughs. And those breakthroughs are just waiting to happen.
We're at the tip of the iceberg of where we're at with some of our new treatments, and I think what we're going to see is more of these incorporated into curative treatment. So instead of using these when people don't have any options left, these are going to be treatments that we use early on.
It takes a lot of work to do research. So philanthropy to help support all the staff that we need to do high quality research, we can't do it without philanthropy.
I think at the end of the day, when you're donating money to any cause, you have to think about, well, why is this important to you? What is it that you want to see out of this? And for me, I would want to make sure that I'm donating money to a cause where this is going to really impact patients directly.
Philanthropy makes an incredible difference. You can't have a team of innovative people and creators that actually establish something that will go all the way to your patients without that support.
We're very patient-focused, patient-directed, and I think that's the important part of it, is that when you donate money, you know that within a short period of time, patients are going to see benefit from that.
I think if I was going to ask someone to donate money towards research, I would emphasize the changes that have happened because of research, how bright the future looks for that, and just how that's really going to benefit themselves, the people they love, the people they know.
We've been given tremendous support and the freedom to actually execute on a mission. The freedom to build a research program for a health system when I think at the time many people didn't think it was possible. And that's made us more competitive, I think, more determined to show people what you can do, to show that we could create something. It's such an exciting time.